Hello all ISGE viewers around the world, young physicians, endoscopists. I have the pleasure of having a wonderful educator and surgeon from Melbourne, Australia, Jim Tsaltas. Hello Jim.
How are you?
I'm so excited to announce that you will go into detail about our meeting coming in Australia.
Yes.
And part of ISGE, there's nothing better for us to announce our viewers. Tell us, what is going to happen?
Well, firstly, I would like to invite everybody to Sydney, Australia, which is one of the most beautiful cities in the world, and we are very, very honoured to be able to host the ISGE. The meeting in Sydney will be in May of 2010, between the 27th and 29th of that month. It will be co-hosted by the Australian Gynaecological Endoscopy Society, and as we are aware to me that both AGES and the ISGE are societies that are very, very dedicated to endoscopic surgery and for the improvement in women's health and diagnosis and treatment. And the theme that we looked at with the ISGE and the AGES scientific boards was to look at gynaecological endoscopy and has it come of age, because here we are next year in 2010, and gynaecological endoscopy is probably 21 years of age. We thought that was something that was very, very relevant, and that really it's like your
The operative gynecology,
the
real one, yes.
For operative laparoscopic surgery, and it's like your child having a 21st birthday, and we thought we would use the meeting as an opportunity to reflect on where gynaecological endoscopy has come from, where it is in its current practice, and look at the future of our specialties. So we're very, very excited about the meeting. The topics we'll be focusing on will be hysterectomy, on endometriosis, fibroid surgery, infertility, both in its relationship to fibroids and endometriosis. We'll be looking at adhesion prevention, prophylaxis. We'll also be looking at hysteroscopy, and in particular trying to expand the use of office hysteroscopy, and also looking at the management of pain in many of these conditions.
How about pelvic floor and robotics?
Yes, and so there'll be a session dedicated on pelvic floor prolapse and dysfunction, as well as incontinence. So we'll be looking at the latest laparoscopic and vaginal techniques for those disorders. And what was the other? And robotics. And certainly we'll be looking at laparoscopic oncological surgery, and in particular focusing on the place of robotic surgery in that field.
Also, there will be pre-Congress training for individual. There will be a session or not?
We haven't organised a session at this stage, but we're discussing with the scientific committee and with the ISGE board as to whether a meeting either in Sydney the day before the Congress or even in Melbourne is possible, and we may be able to have a hysteroscopic workshop in Melbourne, possibly on the 25th of May. But the educational aspect of the meeting is all put together, but the Congress workshops are still in a planning stage.
As I stated to you earlier, before coming to Brazil, I had to read in detail about stem cell and endometriosis association. Due to my presentation demanding, I presented modeling of endometriosis lesions, and you had to read stem cell, and I was so excited that you are from also Monash University.
Yes.
This original work was done, and I'm excited to be with you also in Australia, and I'd like to encourage people who are thinking of getting a glimpse of where we are right now, wrap up their knowledge and learn new things coming up. These are the meetings that I personally learned that I cannot learn anywhere else. We exchange information, we exchange tricks,
yes.
we exchange friendship,
yes.
and wonderful people are here, all dedicated, people who believes in what they're doing are here. I think it goes, this is very important. I do feel true passion here.
Yes.
Passionate surgeons, passionate individuals who wants to perfect in precision surgery and to do better for their patients.
And I would agree 100% with it, Tamer. I think that I look at the people, here we are in Brazil, I look at the passion of the ISGE board members that have come here, including also our international faculty. I look at the passion of our Brazilian practitioners in looking at advancing, in particular, endometriosis. And in Sydney next year, we already have 40 confirmed international speakers who are coming to the meeting not only to educate themselves, but to educate our physicians in Australia, and they truly do it in a passionate way. And I think that if they can inspire one young gynaecologist to improve their practice and therefore improve their the well-being of our female patients, then the trip's been worthwhile. And with this fantastic faculty, as I mentioned, over 40 international speakers and almost 30 Australian speakers, we would hope to inspire a whole generation of Australian and Southeast Asian gynaecologists.
Dr. Jim Tsaltas, Melbourne, Australia. Thank you
very much.
We'll see you in Sydney.
Absolutely. We look forward to it.